Hello and welcome to our session today where we will explore the medication known as Actos, which is the brand name for pioglitazone. As always, this discussion is for educational purposes only, and if you have any health-related questions or concerns, it's important to consult with a healthcare professional. Description: Pioglitazone, marketed under the brand name Actos, is an oral medication that is part of a class of drugs known as thiazolidinediones. Actos is used alongside diet and exercise to improve blood sugar control in adults with type 2 diabetes. By making the body more sensitive to insulin, it helps to control blood sugar levels. Pioglitazone is not for treating type 1 diabetes. Warnings: Actos does carry warnings as it may cause or worsen heart failure. Patients should be monitored for signs and symptoms of heart failure. It's not recommended for individuals with active bladder cancer, and caution should be exercised in patients with a history of bladder cancer. Liver tests should be checked before starting treatment and periodically thereafter due to the risk of liver injury. If you experience symptoms of liver problems such as nausea, vomiting, abdominal pain, fatigue, anorexia, or dark urine, you should contact your healthcare provider immediately. Before taking this medicine. Before beginning treatment with Actos, inform your healthcare provider if you have any allergies to the medication, or if you have a history of heart disease or heart failure, liver disease, bladder cancer, diabetic eye disease, macular edema, or if you are in a state of diabetic ketoacidosis. It's also crucial to discuss if you are pregnant, planning to become pregnant, or are breastfeeding. Patients with congestive heart failure should use caution when taking Actos, as it can exacerbate the condition. It's also important to inform your doctor if you are taking insulin or other diabetes medications, as they may need to adjust your dose. Side effects: As with any medication, Actos can cause side effects. Common side effects include cold-like symptoms such as sneezing, cough, and sore throat, headache, gradual weight gain, muscle pain, and back pain. Some side effects can be serious, such as new or worsening heart failure, bladder cancer, liver problems, and macular edema. If you experience shortness of breath, sudden weight gain, swelling, blood in your urine, or unusual changes in vision, seek medical attention immediately. Interactions: Actos can interact with other medications, which can affect how it works or increase the risk of serious side effects. It's important to tell your healthcare provider about all the medications you take, including prescription and over-the-counter drugs, vitamins, and herbal supplements. Dosage: The dosage of Actos must be tailored to the individual's needs and is determined by the healthcare provider. The usual starting dose is 15 or 30 milligrams taken once daily, and it can be adjusted based on the patient's response. It's important to take Actos exactly as prescribed by your healthcare provider. Avoid: While taking Actos, patients should avoid alcohol as it can increase the risk of developing low blood sugar and may contribute to liver problems. Also, patients should not use Actos if they are in a state of diabetic ketoacidosis. FAQ: A common question about Actos is whether it can be used in pediatric patients. Actos is not approved for use by anyone younger than 18 years old. Always consult with a healthcare provider for advice about treating diabetes in a child. Closing: This concludes our overview of Actos, or pioglitazone. Remember that this information is intended to provide educational knowledge and should not substitute for professional medical advice. If you have any questions or concerns about your health or medications, please reach out to a healthcare provider. Thank you for joining us today.